Good morning to you all.
Good morning.
And welcome to this advocacy forum organized by Gamnass. The Gambia network of 8 support societies is the umbrella organization of the PLHAs. And as you all know, it is a sub-recipient under RTPC WA, RTPC West Africa, which aim is community-based monitoring, offer the potential of increasing domestic oversight of advocacy of improvement to PLHA treatment, particularly as it affects key population. The thrust of this request for funding is to improve current the request of funding to improve catalytic support to centralize and standardize treatment access data that is currently being collected in a fragmental way, to improve regional advocacy for art access. This project is being implemented by 11 countries in West Africa, and Gambia is part of these nations. So the creation of community treatment observatory as pioneers by International Treatment Preparedness Coalition, ITPC, PR for this grant involve structured groups of PLHs, usually through national PLHA networks, collecting data in a systematic way to monitor the drug supply system in each art site, and to document and alert activists of critical art stock level and management or mismanagement issues. PLHs and their allies are trained, provide with appropriate hardware and software, and provide with technical assistance to collect and analyze appropriate data, and to use this data for advocacy to increase access of treatment. Comprehensive data was collected, validated, analyzed by PLHA community members on the number and type of art medications available in each art site, quality assessment of art delivery and associated diagnosis, facilities against national treatment guideline, number of and reason for stock out of art and diagnosis kits, specific issues preventing art assessment by key population, PLHA knowledge of HIV diagnosis and treatment. Mr. Chair, ladies and gentlemen, today is another milestone for us as a Gambians to come together as one nation, support each other to look at validated document. And this advocacy comes up with solution to support those at risk and the key population and the key affected population. Mr. Chair, distinguished ladies and gentlemen, you will agree with me that the fundamental treatment observatory mechanism for our country will surely be an opportunity for PLHA in the Gambia to play a visible part in the fight of this catastrophic disease, which have no burden, been rich or poor, all, young or old. If there's access of quality treatment services to all PLHs in the Gambia, this will further contribute immensely to the achievement in the fight of HIV and AIDS in the Gambia. Gamnass seek the support of government, development partners, including private sectors, to involve in the fight of HIV and AIDS by contributing immensely in supporting PLHA. Looking at our country, there is only one viral load machine, and whenever that machine broke down, the entire country is affected. In HIV and AIDS, if you are not infected, you are affected. So it is a responsibility of all of us to come together and find solution in eradicating HIV within our community. On this note, Mr. Chair, I thank everybody for...
I'm quite awake. Chairman, thank you very much for inviting the steering committee. I'm speaking on behalf of Dr. Sabali, who is the chairman of the project steering committee. He wasn't able to come because he has some emergency cases to treat. You know, today is the beginning of the week after the break, and some patients rushed to the clinic in some difficult conditions. So as a physician, he wasn't able to. So he asked me to step on his...
Take this opportunity to remind ourselves that this is indeed a privilege, and we should ensure that what is expected, as Mr. Cham has said earlier, in terms of the objectives of the project, in terms of the outcomes are achieved. Not only looking at both in terms of quality, but also efficiency. How efficient are we delivering? It's not just any project. This is a regional project. The country's reputation is at stake. Our institutions are at stake because we all came together to develop and get this project. So I think we owe it to our country, we owe it to the PL community We owe it to to Global Fund. We owe it to IPTC to demonstrate an effective and efficient delivery of this project. I think I want to urge members that we should respect the governance of this project. I think really we need to focus on how do we ensure that governance of the project is respected. Because we're not the only country implementing. It's 11 countries, and we're going to report. We have to demonstrate the results come the end of the project. And this is an opportunity for us to say that we have the respected governance structures and issues, because we'll be taking to task. So we don't want to be found wanting. So I think this is something that should re-echo in our minds. This is a national project. It's not an individual project. It's not a Gamnass project. It's a regional project. It's a national project. So let's bear that in mind. Let's define what our roles and responsibilities are. Each of us have a role and responsibility in this. All partners we should have clear definition of our roles and responsibility. This is for the sake of accountability and transparency. We have to account for whatever our contribution, our roles are in this project. So I want to appeal to those managing, coordinating this project to have this in mind, that we have to be accountable to our members, we have to be accountable to the donors, we have to be accountable to our countries, we have to be accounting for results that we produce out of this, this project. I think we need to bear this one, and we should be transparent in doing this. All members, everyone should be aware of what is going on, how the funds are managed, who is managing what, and it has to be based on the guidelines that have been given. Clear guidelines have been given for this regional project, because we're not the only countries. So let's follow those and adhere to those to ensure that we deliver effectively and efficiently. I think it's important. And this is also calls for us so that it's an opportunity for us to do resource mobilization. Because if we are able to achieve the results that we have agreed in this project, it's an opportunity to scale up. It's an opportunity to tap more resources, because we have the resources, and we can tap other resources, including domestic resources, showing that we are capable and we have efficiently delivered. So I think we should bear that in mind. In terms of the advocacy messages I want to address, really for you, from UNAIDS and the UN system, is around the 390s. And right now, we're in the process of developing a national catch-up plan for the Gambia. I think a need was created in the West Africa region. We had invited some of you at the consultative meeting to show that in West and Central Africa region, there are gaps, particularly treatment gap, that needs to be addressed urgently. And as a result, we're now developing a national catch-up plan to address this treatment gap. And it's basically around the 390s. And this is really aligning to the objectives of this project. I think we all know what the 390s are, and you have addressed it in this project. At least the preliminary results are showing that there is some alignment in terms of the 390s and the data collected. I think for those members, I asked for means at the centralized level to ensure that we don't have the stockouts. what are the mechanisms, what are some innovative things. Remember, we are selected out of the whole West Africa region, 11 countries. So they expect us to come up with innovative ways of doing this, because they're going to use this as best practices in other countries. We want come the next 4, 5 years to say this was done in the Gambia, and these are the things that we can say we were able to achieve. We can share with the larger West African community. We can share with the Africa region. We can share with the world. So I think it's important that results of this project is important and should feed into this. Because one of the key recommendations or success factors of the catch-up plan in other countries is community involvement. Communities coming with innovative ways to ensure that we have accessible, reliable ARVs everywhere by all. No one is left behind. So I think we should be able to, at least coming out of this validation, to submit to NAS and say, we feel for the communities, for what we have so far, these are the gaps. These are areas that needs to be addressed, and come up with recommendation. I like the idea of the adherence, community adherence clubs. We're looking for innovative ways to get communities involved in this process. And I think it's important that this feed into the catch-up plan and in our advocacy, in our policy decisions, in our resource mobilization efforts. So I hope these also will be captured. 7 countries. So they expect us to come up with innovative ways of doing this, because they're going to use this as best practices in other countries. We want come the next 4, 5 years to say this was done in the Gambia, and these are the things that we can say we were able to achieve. We can share with the larger West African community. We can share with the Africa region. We can share with the world. So I think it's important that to the whole process of ensuring that we attain the 390s in the Gambia by 2020. Be fully assured that we're here to support the process. We're here to ensure that challenges are addressed. We're here to ensure that the requisite resources are mobilized, be it domestic and international, to ensure that we're able to reach our targets. And I want to say thank you to all, and to again, for you us all to recommit to ensure that we have a project and the results of the project are attained at the highest possible efficiency.
The World AIDS Day celebration, the theme this year is Right to Health. Now, in Right to Health, you're talking about test and treat. And you are saying, no, I am only going to concentrate on the key population. Now, you are not going to do any counseling and testing. And the same approach, the same 2015 guideline is saying you need to do more of provider-initiated counseling and testing to be able to identify people early and put them on treatment. So where are you going to fill that gap? And we were able to advocate through the Ministry of Health and to the Ministry of Finance to get, for the first, this coming year, 2018, additional 1,000 people will be started on ARVs. And we said it's a good opportunity, because for the first time, apart from the staffing and the health facilities that the government is giving us, they have never put a physical cast on anything. So that's a plus, and we hope it will continue. You know, that's why this high-level conference was done on the one, to get the presidency, to get the parliamentarians, to get everybody, so that we will know that these are the gaps and this is how we want to be known. We don't just want to sit down and say, yeah, it's right to help, no problem, global fundraising will help. Global Fund can no longer do this. So what can we do at our level as a government? And this is what we have told the government. Yeah, it's unfortunate that most of them are not here, because coincidentally, also we are launching a very line. It's like one of the, it's like any other medical condition. And for the National AIDS Control Program, it is our primary role to coordinate and implement all HIV activities under the Ministry of Health and Social Welfare. So for us to have IPTC who are coming to help, for us is an honor because, like my brother used to say, we are the duty bearers. With all the resource constraints, we cannot say that we are not going to take care of HIV people. It is our primary role. So for us, anyone that is coming to help us to do that work, that is an honor for us to partner with them. All developmental partners are helping government to be able to bring down the prevalence of HIV and also to take care of people living with HIV in the country. Despite all the challenges, we have had great milestones. We have completely integrated HIV services in the country. You have the ART services being provided at 12 sites currently, public and private. ARVs are readily available in most of the sites. We are proud to say that stock out is at a very low level in the country for the past 5 years. We have not had a major stock out. We may have a low stock, which we usually see harvest we can redistribute. And IPTC being a watchdog on us is a good one because the ministry usually, through the minister, is represented in almost all the health forums. And they sign on our behalf signatories that we are supposed to implement. In terms of guidelines, we have moved from mono to dual to triple combination. We have moved from the CD4 level of 250 to 350 to 500 currently. And like I said in the report, one of the advocacy forum messages is test and treat. It's the same thing with the Ministry of Health. We are working towards the test and treat. In fact, the coordinating body under the Global Fund, the NAS, they are here. They know that most of the forum, that is the talk of war. Why should we only give the targets to Global Fund and stop there? What we are saying is let's give the target of what Global Fund can do. And the other one, we can use it as an advocacy forum. And it is good that the UNAIDS was here looking at the catch-up plan. We have IPTC acting as a watchdog. And I remember when the director came, the general director, he visited the NACP. And one of the issues he was saying that under WAHO, he's also among under WAHO, that they're looking at health communities. And one of the issues is under WAHO, they're looking at health communities when it comes to ARVs and viral load. And we said that really, currently the country is at a crisis point when it comes to resource mobilization. And we did spoke to him and he said he was using that also to see what could be done. So for us here, us working as a group, like I said, this is not Gamnass, it is not the PLHIV community, it's the Gambian. And I remember vividly on that day what we told the Director General and including the program officer who was in this was, we need to share data. Because this data that we have generated here and we are validating today, we will need to share that data with the Ministry of Health through our offices so that the minister who represents all of us at international forums will have this very important data to use as an advocacy. And I hope it will be done so that we just don't stop at validating the data here and talking to our data collectors. We will use it as an advocacy forum. It is clear that the test and treat have major gaps in terms of availability of ARVs. And the government will do all it can through its partners to help us bridge that gap. For example, the Ministry of Health has been able to commit for the first time to say like having additional 1,000 people on ARVs. It is happening first time in the country. Why is it happening? Because we saw that gap. Like for us, it's an emergency. It's an emergency when it comes to HIV care. That you are saying it is a crime.
To the information that had been gathered on the IPTC, the Community Observatory Treatment Systems. Okay? This system, we all know, is here to kind of serve as a measure to really see the quality of treatment along the line. And we appreciate, like we are saying, when you are doing something, you need an outsider to look at it and give you comments so that you would know where you have faults or where you have gaps or weaknesses and see how best to strengthen. So if we have somebody doing that, that is very helpful to see us, make us to reflect and see where we need to work harder in some other areas to ensure that people in this country got the quality of care that they so deserve. Okay? As we are talking about the 390s, we all realize that Western Central Africa are very much below the 390s that we are set globally. And as such, the AU have agreed on getting a catch-up plan in order to fill that gap. And that is one measure that people are really doing to ensure people have access to treatment. First, like the 490 say, those who know their status, those who are HIV, to really know their status. And when you know your status, what is next? It's for you to be put on treatment. And if you're on treatment, what is next? Not just being on treatment, but how do we retain you in treatment? And one way of retaining you in treatment is for you to know your viral suppression. Because when you are virally suppressed, the chances of you even infecting another person is very limited. And the chances of you getting OIs is nil or not even there. That will make you to have a quality of life, and you can go on living your life positively as it is envisaged. Okay? So those are the 390s. And again, the other factor, which is really timely this time, is the theme of the World AIDS Day, which is right to health. And as that one, you will see the right to health is a right for everyone to the enjoyment of the highest attainable standards of physical and mental health as enshrined in the 1966 International Covenant on Economic, Social, and Cultural Rights. And this right is not including people living with HIV, neither affected by HIV. And it's your opportunity for you that right to health. How can we advocate? The nurse, through that point, will be advocating for resources to make sure that you get the right treatment at the right time also. Okay? And the other thing also is we all know we have only one donor in this country. As much as all the issues that we've been said, you can only give when you have resources. And that resources from Global Fund is even further limited. And because of that, you can see for the World AIDS Day this time around, the approach for the World AIDS Day was different. They had to call for an approach which will kind of raise the awareness of people to realize the funding gap that is being realized and for commitments to be made. Okay? So that is one area. And then the other area that NAT has also engaged is having to develop a resource mobilization strategy. And this resource mobilization strategy is geared towards gathering more resources to kind of fill in the resource gap that is also there. So this is what we are saying, like most of the issues that are being mentioned, we would love to, but because of the resources. And again, based on that, we have not learned. What we do, since we have the next project that we are going to be implementing, which is called the program continuation, what we did, we have agreed with the Global Fund to kind of like use innovative strategies and recommendations from WHO, which we call the differentiated care service delivery. And all these things are geared towards making care available to people and also maximizing the resources that you have and also lessening burden on the health system. We all know we have systemic issues, which is also kind of impeding for us to get the results or the targets that we have set for ourselves. And because of that, we are innovating, getting this kind of innovations, which is how do we retain patients in care? How do we implement this differentiated care? We just finished mentoring, and what we do during the mentoring, we are kind of assessing around the way, because differentiated service delivery is just a new name given to it, but the concept is already here. That is like making this thing patient-centered approach, and that we have been doing. We are saying, should we be giving monthly appointments to people all the time? Is it necessary? No, because you can give them 3 months, depending on their stability. Are they stable? Can you trust them for not to come? When you do that, it is just less burden for the service providers and making other people that need your service or need more attention for them to be given to them. So these are some of the strategies that we are going to be looking through for the next project, which is starting January 2018, in having to answer some of these weaknesses or some of the gaps that we have in the service delivery as a coordinating authority. That's what we have. Thank you very much.